Hi, my name is Alejandro Carrasquilla. I'm a neurosurgeon at Texas Back Institute. I'm originally born in Bogota, Colombia, but I grew up near New Orleans, Louisiana. I've always been drawn to math and science. My parents are engineers, and for me, medicine was the application of science directly to people. And that's something that was very special for me. Went to university at University of Alabama. Then I went to University of Pennsylvania for medical school. From there, I went to Manhattan to Mount Sinai Hospital to train in neurosurgery. And then I did a neurosurgical-oncology fellowship at Moffitt Cancer Center in Tampa, Florida. When I was an undergraduate student, I majored in chemical engineering because my parents are engineers with the intent of going to medical school. But I worked in a research lab studying movement disorders. And learning about deep brain stimulation initially piqued my interest in neurosurgery. That was so powerful to me, not just the application and the impact that it has on people, but also the science behind it. And ultimately, it was the most exciting and fulfilling thing that I found I could do. It really solidified my interest in neurosurgery because I saw patients in various different branches of neurosurgery that were grateful to their team, you know, whether it be trauma neurosurgery and people finding themselves in situations that they never anticipated, whether it be spine surgery where people are debilitated and need treatment to get back to their normal lives. These various different patients all really solidified my interest to learn this skill and to become a neurosurgeon. We're here at Texas Back Institute. We apply that knowledge and that training to help patients here in the Dallas-Fort Worth metro area. I feel lucky and blessed to be at Texas Back Institute. One very large reason for that is the other physicians who are in the practice, you know, and this is really a partnership, a collaboration between leaders and experts in what they do. And, you know, we can rely on each other and form a community of physicians. Additionally, Texas Back Institute has a very solid history and position in the community. The practice has really grown, has brought together a lot of expertise, and has gathered a lot of resources. And to be part of that, to be able to utilize that to help my patients, I think is really a blessing. My patient care philosophy is to connect with patients. Patients need to find a physician who has knowledge, skill, and resources. But in addition to that, they come with their own understanding and their own viewpoint. And they need a physician who will connect with them, see where they're at, inform them from a medical perspective, but also understand their unique needs and what they are looking for to best treat their pathology. So I speak English, of course, and Spanish, and I speak what I like to call Portuñol, which is Portuguese with perhaps some Spanish mixed in, and you know, I'm slowly learning some Japanese. Our aim is to treat patients of any language, whatever language they may speak, and we have interpreting services, but whenever I can, I like to connect with patients using the language directly. So I enjoy speaking Spanish in the office. If they speak Portuguese, I'll speak with my limited Portuguese. And if any patients can teach me some additional Japanese, then I'm always open to that. So what's neat about surgery is that it's a combination of science and art. It really is. And I draw a lot of parallels to cooking also, because you have a recipe, you have a protocol, you have your ingredients, you know you want a certain outcome. you follow the protocol to a T, but your oven may heat a certain way. Your ingredients may come in a certain quantity, a certain size. You want a certain flavor profile. And regardless of how much you follow the protocol, it really takes a little bit of nuance from the chef to get it to that optimal outcome. And so even if the recipe says heat your oven to 450 degrees for 15 minutes, it might be best done at 17 minutes. And it's only the chef who can really make that decision. And surgery is a lot that way. Surgery requires one to have a deep knowledge of medicine, science, and the protocol for the operation, but also to pick up on the nuances of that patient's anatomy, that patient's physiology, and to, with experience, use those nuances to best treat the patient. I want my legacy to be one of an individual who goes above and beyond to meet people's needs, to really connect with them, to communicate well, and to really care to continuously make our community better.